What's the best treatment for iliotibial band syndrome? This will shock some folks, but the best treatment that I think for iliotibial band syndrome is prolotherapy. You have to realize I see chronic cases. So in other words, the folks that come here to Caring Medical in Oak Park, Illinois, they failed physical therapy. They stretch, and nothing works. Okay, so you got to think of like, maybe your iliotibial band is contracted because it's trying to stabilize something. So what would it be trying to stabilize? So if we look at the side here, the iliotibial band goes along the lateral side of the knee. So what do we see on the lateral side of the knee? You see all kinds of ligaments. There's actually a lot of ligaments on the back of the knee too. So if you have iliotibial band syndrome and it's not getting better with stretching, you have to consider that you might have posterolateral knee instability. So in other words, if you have instability on the lateral side of the knee, then the iliotibial band's going to contract. So there are times where a muscle is contracted, or a fascial band like the iliotibial band is contracted to stabilize an unstable area. So when you get prolotherapy for iliotibial band syndrome, while you're getting prolotherapy where the iliotibial band attaches on the lateral side of the knee, and the doctor, like myself, the prolotherapy doctor, is stimulating those ligaments that are causing the posterolateral knee instability to tighten. So the ligaments tighten. The attachments of the iliotibial band get stronger with prolotherapy. And then after 3 to 6 visits, normally the problem resolves. So there definitely are times where muscle tightness, fascial tightness, it's the body compensating for an unstable joint. So if you have chronic muscle spasm, whether it's the tensor fasciae lata, the iliotibial band, your low back muscles, your neck muscles, and you stretch, and it's not getting better and it just gets tight again, you have to think that that muscle is compensatory. It's contracting because it's trying to stabilize an unstable area. So the treatment for joint instability, for knee instability, for low back instability is prolotherapy. You have to get the ligaments tightened. So I think probably some folks who have iliotibial band, that's probably the first time you heard that, but that's normally what it is. For any athlete who really wants to understand how joint instability causes problems, I really encourage you to get the book, Prolo Your Sports Injuries Away. I wrote about almost any sports injury, medical condition that an athlete could have, including snapping hip, iliotibial band, and a lot of it is joint instability. So if you get that joint stabilized with prolotherapy, then the iliotibial band syndrome goes away and the other kinds of chronic muscle tightness issues go away with prolotherapy. Typically 3 to 6 visits done every 4 to 6 weeks. You could still train, and guess what? You won't be probably doing iliotibial band stretches. So if you're sick of doing iliotibial band stretches, then get prolotherapy.